Okay, welcome to our broadcast. I'm your host, Doug Grafsky, a Senior Digital Strategy Manager with the Providence Digital Innovation Group. As a reminder, the information provided during this live event is for informational purposes only. For any medical questions, please reach out to your primary care or healthcare professional. All right, now let's get started. Joining me during this live event will be Sara Vaezi, Chief Digital Strategy Officer, and Aaron Martin, Executive Vice President and Chief Digital Officer at Providence. Welcome to you both, and thanks for taking the time to share today.
Thanks.
Thank you.
Absolutely, thanks. So before we dive in, can you each just give me a little bit about your roles within Providence and what you do at Providence?
Sure. I'm the Chief Digital Officer, three parts of the organization I work with. One is our marketing team. Second is our digital team, which owns basically any of the consumer websites or the apps that patients use. We also have a digital incubation platform that creates new companies. And then the third part is Providence Ventures, which is a $300 million venture fund with 18 active portfolio companies.
Thanks, Doug. And I lead our digital strategy efforts. So especially in the digital group that Aaron just referenced, that looks at our kind of consumer-facing front end for the organization. And then I work very closely with our product teams and other folks across the organization when we are doing incubation to create those new companies. So that Aaron referenced. So when we build something, we take it to market, and I work kind of cross-functionally to lead those efforts along with others.
Wonderful, very exciting. So thanks for the introductions. So in directing us over to the topic of today's conversation, which is industry consolidation. Sara, can you please give us a brief overview of what we're talking about when we say industry consolidation? And then dive into the biggest drivers of consolidation that we're seeing in the market today.
Sure. So, industry consolidation often means M&A activity, mergers and acquisitions, and that can apply in so many different sort of industry segments. And I would say, kind of specifically focusing on what we've talked about and where we've looked, there are kind of two primary forms of consolidation that we've kind of separated from one another. One is the traditional types of consolidation that occur within sort of the players that we're all used to: health systems, provider groups, payers, and to some extent, even financial sponsors like private equity, and venture capital. And so that means, just like how assets are coming together, how different organizations are coming together to deliver value in different ways. And then on the other hand, we've looked at sort of disruptive in M&A or consolidation activity that might be driven by sort of like the pure tech players, whether they're big or small. They could be these kind of healthcare specific tech startups, or even larger organizations like the Teladoc Livongo news, which we all heard about, and we'll touch on it in a little bit as well. They can also be sort of like, there's this kind of newish breed of consolidation happening among the retailers. So we've seen again, like Walmart, for instance, is doing a really interesting partnership with an insurance company. So they can take kind of these two different forms as we've envisioned it, whether they're traditional or disruptive in nature. And there's a lot of reasons why, of course, this kind of activity occurs. And fundamentally, it's based on delivering value to the market and to patients and providers, and hopefully, making driving costs down and adding better value and improving quality, and delivering on the quadruple aim in healthcare in general. I would say what's kind of changed with respect to COVID-19, which is kind of your question, right? Like, what are the drivers? And by the way, I will add that there was a big question back in late winter, early spring, when we started to experience a lot of the impacts of the pandemic, which were, kind of related to the economic downturn. There was a lot of question as to whether consolidation and M&A activity was going to slow down or it was going to speed up. And what we've actually seen is that it has sped up. So what would be some of the reasons for that, right? Like, what are the drivers of all this activity? One of them is that there have, especially on the provider side of things, some organizations are really financially distressed, in particular those that were in sort of a traditional fee-for-service system. And so it's really kind of exposed those organizations to some additional risk and as a result of their reduced revenues. So meanwhile, there are other industry segments like the payers, in particular some of the large national payers who have posted record profits because a lot of providers had to cancel surgeries, for instance. And so they didn't have to pay out, and now they're flush with cash effectively. And so there's kind of that interesting financial dynamic, which is driving a lot of this kind of activity. The second is that, what I alluded to with respect to fee-for-service, the pandemic has really exposed the flaws of a fee-for-service system that isn't incented to keep people healthy. And so the industry as a whole, which we've sort of been like, thinking and talking about this issue quite a bit, but most health systems are still largely in fee-for-service. The industry as a whole is recognizing that model is not sustainable. And so, like I can say from a Providence standpoint, our population health team in particular is going to be deliberately sort of moving toward risk in some key segments in particular. And so that's going to necessitate new care models that are going to require investments and are also going to make some assets that are out there more strategic than others in order to help us manage that movement to risk. So that was kind of a long answer in terms of like all of the factors associated with what this is and why we're doing it. But I think it really is important in terms of setting the context for what we're going to talk about around digital innovation opportunities and implications associated with it.
Great. Thanks for setting the stage there. Sorry, I know it is quite a meaty topic. So as we think about the consolidation that we're seeing, on one hand, we of course have the purchasers, the groups or the entities that are making the acquisitions, and then of course the assets that are actually being acquired on the other hand. So Aaron, as we're thinking about the landscape of assets that are available in the market, how are you thinking about how those will come together? Are some of those assets more valuable or more strategic than others, or others going to be less relevant moving forward?
Yeah, I mean, I think the obvious thing is it's about the kind of healthcare's front door is kind of where the battle is joined right now. Mm-hmm. And that by necessity means kind of, two types of practice, either kind of same day care. So you think urgent care, think, retail healthcare. That's kind of the CVS Aetna play. Mm-hmm. What Walgreens has been doing, and then also think primary care. And so you're going to see, a lot of kind of acquisition activities and kind of partnering activities around, who does the patient see first, and what could possibly be a very kind of long trail of other kind of, surgical specialty types of appointments kind of, downstream. And so that kind of pinch point in the healthcare value chain is right now very, very valuable, right? So the irony is that, for the longest time, we've not had enough primary care and they've been underpaid. But however, their businesses are now, kind of going up in terms of value because there's so many different disruptors in the marketplace. So we'll have to see, kind of how all that kind of shakes out. The other thing I would say is a lot of these disruptors if they have insurance plans attached to them, they don't have to buy or even have a significant footprint in the market to have impact on the entire market. This is something that, the CEO of our health plan, a point that he made, which is, you have Optum kind of going into markets and just buying a few practices and having a huge impact on kind of the local fee structure, which they get a multiplier impact, in terms of the first premium. And so they're actually able to kind of, it's have your cake and eat it too. They're actually able to spend relatively little amounts of money and benefit, but pay up probably super premium prices for those practices. They're also not restricted from, by a bunch of kind of regulatory issues that most, health systems are, and then benefit mightily in terms of the premium. So you're starting to see those kinds of activities as well.
Yeah, and I would add to that, which is like what Aaron has alluded to around healthcare's new front door. We kind of segmented it out into 3 different categories. So we thought about assets that are not maybe like as strategic, given that everything has happened. There are high value assets that were high value before, and they continue to be very high value. And then there may be certain things that are newly strategic. So the things that, what Aaron just alluded to around Optum, for instance, what they've done is they've reaped all the benefits without getting so much of the cost, right? And so things like hospitals are going to be less strategic probably going forward in an environment that's extremely cost sensitive and constrained in terms of its financials. Primary care groups, speaking of, Aaron mentioned like primary care and the front door are absolutely essential. They were before, and they're going to continue to be going forward. And then there are things that that with this deliberate movement toward more value-based care, as well as just this whole kind of proliferation of all these front doors, there are going to be certain new types of technologies or new things maybe that existed but are going to be accelerating in their importance. Things like a lot of work around, for instance, how you do demand aggregation, how you intelligently match supply to demand, and how do you get patients to the right venue of care? How do you navigate them there? Those are going to be more strategic than ever. And so those are sort of the 3 buckets that we thought about it in.
Thank you. So let's talk a little bit about timing. So knowing that this really disruptive force kind of first hit health systems in mid or even late March across the country, and I think Providence might have even seen one of the first confirmed COVID cases. But what activity have we seen since March? What types of consolidation efforts have occurred, and then what other types of activity you think will happen in the coming months to close out 2020?
Well, I would even maybe frame it differently. There's been so much activity in so many different dimensions. There's been a lot of actually IPO activity. There's been a lot of types of partnerships like Teladoc and Livongo. There have been partnerships like Walmart and Clover. There's a ton of activity going on. And I would say from a health system perspective and how it will impact us from a digital innovation standpoint, how we need to be prepared, I'm kind of thinking about it in terms of like, what's most pressing now, and where do we potentially think the most impact is going to be? And then in the medium term. Now, I think, again, to Aaron's point, like the big national players and what they're doing around redirecting and creating new front doors and directing care to their front doors is going to be the biggest impact going forward and in the near term. And so what Optum has done, they've, for instance, in our markets in Seattle, they acquired the Polyclinic, which is a major medical group. They acquired the Everett Clinic, which is also in a suburb of Seattle. They acquired DaVita, which is in California, and so they're really controlling the providers, and there's going to be all this how those providers, for instance, bring their inventory and become online, how their data is presented online, how their appointments are scheduled online, so schedulable inventory, how patients are directed there and how they are then directed beyond there to other services. That's going to be a huge impact on us. And health systems need to be really prepared to have that same kind of presence on digital properties where patients are looking for care and beyond. So that's like the near term thing. I think medium term, the retailers are really going to get their act together. And with increasing consumerization, increasing price sensitivity among patients, we're really going to need to have some differentiated and really appropriately priced services in the market, with that same level of convenience and presence and digital front door access in a bunch of different modalities and places where figuratively places where patients are looking online. And I think that those that's going to have a longer, like, it'll be probably more medium term. And then there's the longer term issue of what the big tech is going to do and how they're, Google essentially controls the internet, and that's the ultimate front door. And so how we work vis-a-vis that, for instance, is going to be kind of the longer term. And when I say near term, I mean now until 12 months from now. Medium term is going to be 6 to 18 months when we're really going to feel the impact. And then longer term, I'm thinking a little bit like probably 18 to 24 months, we're going to start really feeling the impact. Aaron, would you add anything to that?
Yeah, I would. I mean, I think in that long-term piece, disruptors typically take the path of what is the most amount that I can do with the least amount of physical infrastructure, right? And so if you look at the motivations of everybody involved, incumbents typically, like us, like health systems, we typically try to optimize it. It's a sunk cost argument. We always try to optimize the thing that we've already invested in, which is, that's business school 101. Don't do that. As a matter of fact, when I went through Wharton, they told me two things walking through, and we were joking about this yesterday. Price has no relationship to cost, right? And they explained what a sunk cost argument was, right? And they said, when we teach you this, you're going to hear these two things happen a lot. And what I found is I hear it all the time in healthcare, which is, well, we price this service based on our costs, not based on what the consumer will pay and the value they're getting. And then the second thing is we constantly make arguments about, well, we have this asset that we invested in, we're going to try to optimize around that asset, right? And so disruptors have the luxury of having zero business today, and you as the incumbent have all the business. And so they don't really, everything is upside to them. And then the second thing is that they don't have to go through these stages of infrastructure investment to get, if the technology is in the right place, to get to where they need to be. And so if you look at kind of what Amazon is doing, if you look at, some of these tech startups are doing, there is very little thought of infrastructure in their models at all, right? Like, they're not even thinking about clinics. They're thinking about, like, I'm going to send the physician or the nurse practitioner or the EMT out to the home to see you. And then there's also, a lot of kind of thought around what can the patient do in terms of self-exam, right? Using, different kind of diagnostic tools themselves. And then there's also obviously, video visits and async, and so it's interesting. I've had a conversation with many primary care leaders, both in our health system and externally, and I ask them two questions, which I think illustrates the problem that we're facing. One question is, with the advent of COVID and everything going online for a while, and it, being kind of like 80-90% video visits for a while in primary care, what do you think is achievable long term, right? Like, hypothetically, what types, what percentage of exams could be done just on video visit without any kind of, sending somebody out to the home or whatever, if you had to do it, right? And if it was clinically safe and responsible? 40% is the number I always hear. Then I ask a second question is, where do you think it'll settle out? Between 10 and 20%. That's the problem, right? Like, it's that spread there that incumbents will take advantage of all day long, because they won't we'll do 10 to 20%. They'll do the 40%, which improves their cost infrastructure, it's a better patient experience, I would argue, for most cases. And they'll typically target younger populations that can do this, that have fewer kind of, problems you need to see at home. So I think what health systems need to kind of get in the mindset of is stop with the sunk cost arguments, start thinking about what's going to happen, because it's gravity. You're not going to be able to fight it, and get ahead of it.
that's a really, really great point. I think that's a great way of looking at the problem. So you talked about that kind of that range that's not being captured by health systems today. And then Sarah was talking about some of the bigger tech players in the industry. We have a couple of them in our backyard here in Seattle. How do you see some the big tech companies fitting into that piece of the puzzle? Are they going to play that demand aggregation role? Or are they getting out and driving, catching the consumers up front? Or do you really even see them on the delivery side? If you want to take that one, Aaron.
Yeah, I think it's interesting. I think you'll see them in the care delivery side for a period of time so that they can learn. I'm more skeptical that they'll do that directly over time. They'll probably start contracting that out because it's a low margin, horrible business if you think about it, right? They like high margin, very scalable kind of technology level businesses. And if you look at kind of how Amazon operates, wherever possible, they try, their number one priority is to control the customer experience. So if they find that they can't control the customer experience without using their own kind of employed physicians or clinicians, they'll do that, right? Full stop. But if they feel like that they can figure out some other kind of almost marketplace way of, having a great experience and not having to kind of own the labor, they'll do that, right? And it's this, but it's definitely, to be clear, it's going to be the customer experience first. And if they can't figure out a way of achieving that customer experience or even better, they'll stick with it. Yeah. So as Sarah said, I think, if I'm a health system, what wave of anxiety should I be having right now? The first wave should be these integrated payer providers, right? So CVS, Aetna, Optum, United. That should freak you out right now. The second wave is the more kind of retailer, kind of Walmart, Walgreens. We're going to experiment with primary care and that kind of thing. And then the third is these big tech disruptors, because if you kind of do the math on all of them, everybody has a permanent place except for potentially an IDN with a primary care organization, right? Because I can imagine a scenario in the future where, you've got most of your care being delivered through asynchronous video type visits, et cetera, with the occasional, if you're a light user, an occasional home visit. You may even get shipped, a package of instruments, to do kind of self-diagnostics. And then if you really have to go see somebody physically, you go to a very convenient kind of, everywhere type of retail outlet, right? And so, the traditional primary care practice in that model is in big trouble unless we kind of really transform the way that we do business.
And so, sorry, we've been talking about all these different activities and consolidation that we'll likely see. In your role as a health system leader, in particular, on the digital strategy side, what should other health systems be thinking about to help, remain defensive against this, or in parallel, go out and actually, try and defend against this? So, what should other leaders be thinking about?
Well, I think there's so. First and foremost, as Aaron described it, I think the challenge is, how do you respond to the proliferation of front doors and make yourself discoverable, easy to transact with, easy to engage with on an ongoing basis, and not necessarily try to folks always say, like, are these tech companies competitors? Mm-hmm. How do you view them? And I think Aaron said this yesterday on a call that we were on. They've got 200 and some odd million Prime customers. That's basically every single credit-worthy person in the United States. And so we can't compete with that. They have so many customer relationships. We just have to have value in that value chain and be present and where folks are looking for care. So have a digital front door or multiple digital front doors, or a role in other digital front doors, right? Not in direct competition, but as a way just to simply serve consumers where they are, right? So I think that's kind of step one. Then as all of this activity occurs, and we've talked a lot about the technology companies, but as consolidation occurs, sponsored by other parts of the other kind of participants in this, what's going to happen is like some of the referral patterns are going to change too, right? And so that's going to have a lot of, if providers can't, for instance, make easy referrals into health systems for specialists, that's going to be an issue. And those upstream referral channels are going to change a lot. So health systems need to be kind of prepared for that. We also need to, and a big part of that is going to be data interoperability. So providers need to be armed with the information that they need, more than just that episode for an individual. Like providers don't want to provide out of context care. They want to take into account the rich history of an individual, so that they can provide the optimal care. So interoperability and continuity, at the very least, across sort of a given problem is going to be really important. And providers need to be prepared for that. And so those were, like, from a digital innovation standpoint, I think those are a couple of the things that we really need to start thinking about, both on the kind of consumer facing side as well as on the provider facing side. There's going to be probably, we've talked about, like, the industry has talked about, like, the creation of focused factories, and there are certainly some like specialty specific consolidation that has occurred around, like, urgent care centers and ambulatory surgery and behavioral health and some other types of things like that. That's probably going to continue as well. And so we need to have some continuity across those different silos in order to make, treat people kind of like as whole people and make the caregiving experience better.
Yeah, I would just add that there's, this was something I was talking about pre-COVID, and I was, kind of, as Sarah knows, because she was at a bunch of these, back when we used to have conferences where there were people sitting in seats and that kind of thing, I would kind of, pound the table about, the health systems need to get our proverbial act together very, very quickly. And I said, we've got 12 to 18 months to respond. And also the time for kind of originality and experimentation is probably over. If you find a way to do it, go ahead and do it. And I talked about, like, you got to get digital transaction ready, and you also start to kind of build an engagement platform. And the reason why I was talking about that is, if this can end up one of two ways, to being very simplistic, this can end up like the travel industry, which would be a good outcome, which is, providers of services have a relatively equal, if not better, relationship with the consumer than the demand aggregators, right? So if you think about Expedia or even Google or folks like that, like, these brands are still, relatively relevant. Now, COVID's taking care of that, but just kind of stay with me for a second here. But imagine the travel industry as it were, and there wasn't a pandemic impacting it, right? The second, how they did is they invested early enough in their own technology so that when they got a new customer through one of these demand aggregators, their job was to build loyalty, right? Through points programs, through technology, through making it easier for you to work with that, so that your next booking goes directly to them, right? Instead of going through, Expedia or whatnot. So think of, Alaska Airlines, they make it very, very easy for you to book with them directly, right? Or it could go the way that the publishing industry did, is they kind of waited until literally the last minute to make any digital investments of themselves. And so Amazon, kind of not out of, like, a sense of trying to impose their will on the industry, just out of necessity, had to basically say, this is the technology stack you're going to use to deliver digital books, because you haven't bothered to make that investment yourself, right? Their whole goal was just to sell digital books to consumers. But the industry didn't make the investments early enough.
Great. No, those are great corollaries to compare healthcare against. Great points there. So, and checking the clock here, it looks like we're at time. So I want to be respectful of our audience's time and everyone's calendars here. So thank you to Aaron and Sarah for joining us today, and for everyone who is able to join and listen in and sending in your questions. To learn more about our initiatives, programs, services, and ways to give, or if you're even seeking medical care, please visit providence.org. And then for more information from the Digital Innovation team, you can visit us at providence-digitalinsights.org. And make sure to follow us on social media at Providence Health System for LinkedIn, Facebook and Instagram, and Providence on Twitter. Thank you, everyone.